Okay, I'm Amanda, and this is Lauren, and she just had this beautiful baby.
He's a star
boy.
Star child.
Star child. And we're going to do a head-to-toe assessment on him. So the first thing I'm going to do is I'm going to take his vitals, his heart rate, his respiration, and his temperature. So, heart rate, always take it apically, which his heart is right here. And I'm just going to take a listen with my stethoscope, which is new and high-tech and through my fingers. And then you're going to count the respirations and take the temperature. We want to see how his activity is. So right now he's awake and his posture is flexed, which is what we want to see. Abnormal would be if he is extended and loosey-goosey. He has a very lusty cry, so that's good. A vigorous cry would also be good. If there's a weak cry or he has not cried at all, that's bad. Skin, he has no skin lesions, so that's good. He's nice and pink.
Like his mom.
Yeah. And he's not yellow tinged or yellow, so he doesn't have jaundice, which is good. He's warm, and he has moist mucous membrane, so he's well hydrated. His skin texture is thick, and it's not translucent or clear. It's not cracked and leathered, but it's peeling a little bit. And you can see he's got mostly bald lanugo, which is good. It's not abundant. There's not much hair on this baby.
Oh.
He does have a lot of vernix, which is why he's so silvery, which is good. No Mongolian spots, but that would be normal. He doesn't have any stork bites either. So his nail length, it's to the end of the fingertips, which is what we like to see. He's kind of bald. He doesn't have much hair, but that's okay. His head, it should be round and a little molded, but his is a little odd shaped, so that's something we need to look out for. Make sure that there's no bleeding. Make sure that his bilirubin level's normal because he's very pointy. His fontanelles are flat, which is good. They're not, well, I guess his are a little bulging, but they should be flat. They're not depressed or sunken. That's how they should be. Now he's perfect. He doesn't have any scratches or head trauma. His neck is nice and supple, easily mobile. So that's good. His eyes, he doesn't have epicanthal folds like you can see. There's no discharge coming from his eyes. The sclera is white up here. He's got kind of large pupils, but it's cute, so that's fine. We're going to give him erythromycin drops to prevent blindness from gonorrhea or chlamydia. We say drops, but it's really like a gel substance. His ears are in line with the canthus of the eye, and they're not low set. They have instant recoil when pulled apart towards the eye, so that's good. Beautiful recoil. Patency. He doesn't have a nose, so...
We'll give you one. Everyone should have
Now
one.
his nostrils nice and patent. He can breathe out of there, which is good because babies are nasal breathers, so... So if I stuck my finger in his mouth and he sucked on my finger, we would know that he was a patent breather because they're nose breathers, so do that. His mucous membranes are pink. They should not be yellow tinged. Epstein pearls are normal. They're not teeth. They're just white deposit buildups, calcium. His palate is intact. He doesn't have a cleft lip, and his lips are symmetric, beautifully symmetric. Okay, so respiratory rate, it was between 40 and 60, which is good. If he was sleeping and it went down to 30, that would be normal. His rhythm was regular, and his breath sounds were clear to auscultation, which is good. There's no adventitious sounds. There's no distress. There's no grunting. There's no retraction. His nasals don't flare. He's got a warm temp. His glucose is good. His nipples are perfect. They're everted, which is like what we want to see. They're about 3 to 10 millimeters elevated. His are about 4, so that's perfect. It's right in there. And he doesn't have any discharge, but if he did, that'd be normal. It's called witch's milk. It's just from high estrogen levels. It's completely normal. When we took his apical pulse, the rate was 135, which is good. It should be between 120 and 160. His rhythm was regular. He had murmurs, but that's normal because the ductus arteriosus is closing, so that's fine. He has femoral pulses and brachial pulses here in his arm. And they're equal, so that's good. So his abdomen, the cord's rounded. There's 3 vessels. We counted them. It's fine. 2 would be abnormal if you only saw the 2 vessels, but he had 3. He has bowel sounds that are pregnant, and he didn't have any masses in here when we felt. He's nice, tender, non-tender, soft. He's well flexed. You can see his muscle tone is good. Track. And he's got symmetry. He's got perfect, beautiful symmetry of movement. He has even gluteal folds.
Them folds.
So perfect. His clavicles are, he was a normal baby. He wasn't large, so his clavicles did not get injured during the birthing process. And his spine is closed and straight, so he doesn't have the dimple in the back, and it's not open, so that's perfect. He is a male, so he has 2 testes that are descended, and the meatus is centered, so that's good. If this were a female, she may have a vaginal tag, which is completely normal. She would have the labia majora, which is large, and then the labia minora, which are the smaller ones. His anus is patent. He has passed his meconium stool, so that's perfect. So then we're just going to check his reflexes. So in order to check the breathing reflex, just rub his little cheeky, and he'll turn to me. Yay! Sucking, we kind of already did it earlier when we stuck his finger in his mouth to check his nasal patency. I also felt that he was sucking, so that's good. You can see him swallowing when he does that, so he's perfect. If I were to grab his hands, he would wrap around me for palmar flexion, so that's perfect. Same with the plantar flexion. He'll curl his little toes around me. The Moro reflex, if we were to lift up his arms and drop him, he would go, ah! And then stepping reflex, if we lift him up and put him down, the walker, that's good. And then Babinski's, if I tickle his foot, it goes, flexes like this. So if this is the bottom of his foot and I go like this, it's gonna fan out. So this is a perfect baby with the best assessment possible, and that is how you do it.
You want your baby to be a star.
Yes.